Welcome to the video answers for another Part 1 question set. Let's get started. First question says, in your own words, describe what type 1 error is. So obviously on the board you're not going to have to describe things in your own words, but if you can explain these concepts in your own words, you know you're going to have a decent understanding of them. So type 1 error, or alpha error, means that your study shows a difference between two groups, but in reality there's no difference between the groups. For example, if you did a study to see if taking a daily aspirin would change the color of your toenails, and your study results showed that, yes indeed, taking an aspirin daily will turn your toenails bright green, that would be a type 1 error, because in reality, taking aspirin doesn't change the color of your nails. Next, what trace element is essential to the function of carbonic anhydrase and lactate dehydrogenase? Well, this is zinc. Zinc is very important for a handful of key biochemical processes, such as certain types of protein folding. So if there's no zinc, these proteins won't fold up into the proper three-dimensional conformation, and the enzymes won't work. Next, a 30-year-old man who's experiencing shortness of breath is diagnosed with obstructive lung disease on pulmonary function testing. The patient does not have a history of asthma and has never smoked. The patient is subsequently diagnosed with alpha-1 antitrypsin deficiency. So how does the emphysema caused by smoking differ from the emphysema caused by alpha-1 antitrypsin deficiency? Well, alpha-1 antitrypsin is an enzyme that's produced in the liver that protects the lungs from neutrophil elastase, which is an enzyme that degrades elastin. So alpha-1 antitrypsin inactivates elastase. So when you have a genetic deficiency of alpha-1 antitrypsin, the neutrophils are just doing their job, but they end up destroying the connective tissue in the alveoli, which leads to pan-acinar emphysema, meaning that the entire acinus is damaged. It's pan-acinar. In contrast, smoking causes centra-acinar emphysema, which means only the central part of the acinus is damaged. So think of alpha-1 antitrypsin deficiency in a patient that's diagnosed with emphysema at a really young age, or emphysema in a non-smoker. Next, in what clinical scenarios would you see a nutmeg liver? Nutmeg liver is caused by hepatic congestion, so that if you looked at the liver grossly on biopsy or on autopsy, it kind of looks mottled like the cut surface of a nutmeg. Now we see nutmeg liver in patients with increased central venous pressure or with increased resistance to portal flow. So this would include right-sided heart failure, classically, and also Budd-Chiari syndrome, which is thrombosis or compression of the hepatic vein. Next, you're performing a radical mastectomy and exercise extreme caution as you dissect laterally along the serratus anterior muscle. You do this in order to avoid severing which motor nerve, which would result in what sequela. So you're trying to avoid cutting the long thoracic nerve, because if you accidentally injured that nerve, you could cause something called a winged scapula, which is where the scapula kind of sticks out from the back at a weird angle, because the serratus anterior muscle is paralyzed, so it can't pull the scapula forward. Next, a patient comes to the clinic complaining of severe low back pain that radiates down the back of her leg. What's the most likely explanation for her pain? Well, this is the classic presentation for a herniated intervertebral disc, where the nucleus pulposus protrudes into the vertebral canal, usually posteriorly, and that compresses the spinal nerve root. So if it compresses the L5 or S1 nerve root, which are components of the sciatic nerve, this is going to cause low back pain that radiates down the back of the leg. We sometimes call this sciatica. The next question is about some common buzzwords. Now, buzzwords can be very important for your exam. You can almost breathe a little sigh of relief when you see these in a question, because they're kind of giving you the diagnosis, and then you just have to focus on whatever feature of that disease the question is focusing on, whether it's pathophysiology or treatment or whatever. So know these buzzwords. Calf pseudohypertrophy is seen in Duchenne muscular dystrophy. Goward maneuver is also seen in Duchenne muscular dystrophy. That's where the patient has this proximal leg muscle weakness. So to get up off the floor, these kids have to use their hands and kind of push themselves up off the floor. They walk their hands up their legs until they're upright. Subluxation of the lenses is a feature of Marfan syndrome and homocystinuria. Cafe au lait spots are seen in neurofibromatosis type 1. And a tuft of hair on the lower back is a feature of spina bifida occulta. Next, what type of cell differentiation and maturation takes place at the thymus? The thymus is a site of T-cell differentiation and maturation. The outer cortex of the thymus contains immature T cells, and as these cells migrate to the center of the thymus, or the medulla, they undergo a maturation process. Specifically, at the corticomedullary junction, the T cells undergo a positive and negative selection to make sure the thymus is not generating the wrong T cells. The thymus also functions to positively restrict major histocompatibility complex at the corticomedullary junction. So, on which cells would you expect to find MHC1 and MHC2? Well, MHC1 is found on most all nucleated cells. MHC2 is expressed only on antigen-presenting cells. Next, a 59-year-old man with a 50-pack-year history of smoking sees you for management of his COPD. What's the clinical definition of chronic bronchitis? So there are two types of COPD. Chronic bronchitis is defined as a productive cough for at least 3 months in at least 2 consecutive years. The other type of COPD is emphysema, which is characterized by permanent enlargement of alveolar air spaces. And then sometimes asthma is lumped in with COPD, and I'm sure you know what asthma is: chronic airway inflammation and airway hyperresponsiveness, which of course causes some airway obstruction. So although asthma is a chronic obstructive pulmonary disease, when people say COPD, they actually mean either emphysema or chronic bronchitis. Next, a 50-year-old woman develops a new onset of low back pain without a specific injury. A lumbar X-ray reveals lytic lesions, which raises suspicion for multiple myeloma. So multiple myeloma is a malignant neoplasm of plasma cells that proliferate within the bone marrow, and it releases local osteolytic factors that foster the breakdown of bone and cause all these lytic lesions you can see on X-ray. So what's the characteristic finding on electrophoresis with multiple myeloma? So plasma cells are mature B cells whose only job is to make specific antibodies. So on electrophoresis, you're going to see an M spike, a monoclonal spike of whatever particular immunoglobulin all these neoplastic plasma cells are producing. Most of the time it's IgG, but it could be IgA or some other isotype. And what's the classic finding in the urine of a patient with multiple myeloma? These are the Bence-Jones proteins, which are immunoglobulin light chains found in the urine. Now, these are not detected as elevated protein on a regular dipstick urinalysis. You can only detect them with a urine protein electrophoresis. And that's it for this set of questions. I'll see you next time.